Okay. Let's have a peek at those eyes. Can I get you to look straight ahead? Looks good. Just going to look at the other one. All right. That looks great. And certainly I would feel that you would be a great candidate for laser vision correction, specifically the Lasik procedure. I'm going to assume you know a little bit about what it's all about, but I'm going to walk you through the procedure. As you probably know, in a Lasik procedure, if this is the dome of the cornea, what we're doing is we're lifting a flap on the dome. And this is done, used to be done with a blade. We no longer do it with that. It's all laser, although some people still do it with the blade. But when this flap is lifted, we then use a second laser to reshape the cornea underneath. We're then placing the flap back down, gently back down. And because it's your own tissue, it heals very quickly. Translated, you're back to your normal activities really by the following day. So the procedure is done in this office just down the hallway there. And when you come in, we need someone to drive you, obviously. And we'll give you a little Valium. Not to worry, I don't need any of the Valium. It's all for you. And as far as anesthesia, it's all eye drop anesthesia. So we don't have to worry about injections, which is kind of cool. And that certainly can take care of any sensation. So you shouldn't have to be concerned about that. When we bring you into the room, we're going to lie you in front of laser number 1 that does that flap that we talked about. And that will take all of about 15 or 20 seconds. Doesn't take very long. We then rotate you under laser number 2, and we're going to be lifting that flap, and everything that you're going to be seeing is going to be out of focus at that point in time. And of course, I'm going to be talking you through every step of the way. Not going to tell you every detail of what I'm doing, but certainly every detail of what you're going to experience. And so when you're looking up there in that blurry world, when the flap is up, you're going to see a little red pinpoint of light that I'm going to point out to you. And we're going to want you to fixate on that light because that's when laser number 2 is reshaping the cornea. Now, some people wonder what happens if I happen to lose sight of that light when the laser is doing its thing. And you shouldn't have to worry about that because you should understand that the laser has a tracker on it, and the tracker locks on to the eye so that even if you move a millimeter or so one way or the other, the laser will actually be locked on, visually speaking, to your eye. So don't have to worry. You might think you're going to mess things up if you move. You're not going to mess things up. You might slow things up, but you won't mess things up. At any rate, when that's done, the laser is gently placed back down, and then we repeat the procedure back and forth for the second eye. The whole procedure will last probably about 10 to 12 minutes, not very long. And when it's over with, essentially we're going to be sending you home. Now, after about another 10 or 15 minutes, that anesthetic that we put in there is going to wear off, and those eyes are going to be really pretty uncomfortable. They're going to be watery and teary. However, if you remember to keep those eyes closed, that will minimize it. But most importantly, if you focus on the fact that it will be done in 5 hours, you'll get through that stage fine. As long as you know it's 5 hours, you can see the light at the end of the tunnel. Bottom line, you just go home and go to sleep. Next morning, when you get up, you're going to be feeling human again, except you're going to be seeing better. Although not necessarily 100% better, because there is a little bit of healing over a 3-month period of time. You're going to be on some eye drops, you're going to be on some prescription drops for about a week. You're going to be on some artificial tears for that 3 months. But generally speaking, by the next day, we expect that you should be quite functional. You go to work or do normal stuff. We'll be having you come in to see us on the next day, but you're really back to your normal kind of activities by the following day. Now, we talked about how we're reshaping the cornea, but the other important aspect of what we're doing is that we're going to be using a technology that we refer to as the topography guided LASIK. Now, what that is, this is a technology of smoothing the cornea, and you probably know that term a topographical map. That's when a satellite looks at the Earth and sees all the hills and valleys. Well, we're doing the same sort of thing on the surface of the cornea, where we're going to look microscopically at all the hills and valleys. We're going to take that data, massage that data in some software, and then we're going to export it into the computer that runs the laser. And what the laser does is it uses more energy for the hills than the valleys. Thus, we're smoothing out that cornea. Logic would dictate that we're going to have a better quality of vision. And indeed, the statistics actually bear that out. For instance, the FDA studies, when this topography-guided technology first came into being, tell us that with the issue of night glare, now by the way, everybody will have some night glare at the beginning, but that subsides over a period of time. However, the amount of night glare with the topography-guided technology is actually about 42% less. So that means a lot less in the way of glare. That means better resolution of your vision during the day. So overall, this is all part of the package that's put in there to maximize your vision. Now, we said it takes about 3 months for the eyes to heal and stabilize. The question comes up, what happens after 3 months? My vision is maybe 80% better, not 100% better. Well, if it is, and as long as it's safe to do so, we'll go ahead and tweak things with the laser, because we're here, we want everything to work out for you. So people are generally happy with that sort of prospect, but the question comes up, that's great after 3 months, what about 3 years or 4 years down the road? And really the same thing goes, and what we really will let people know is that we have this lifetime commitment to your vision. And what that means is if your vision ever in the future, because of a focusing problem, not because of some disease or the aging process or some injury, but if your vision, because of the focusing, ever goes away from what we are at the end of the procedure, we'll go ahead and tweak things, and it won't be any extra amount for you. So that's kind of the scoop in general, and certainly you make a great candidate. I think that's great that we live in this day and age that we're able to offer this technology, and you don't have to be wearing those glasses and contact lenses that you hate that you told me all about. So if that sounds reasonable to you, we're going to take you up front and continue this dialogue and get some other measurements for you. Does that sound like a plan?
Sounds like a plan.
All right, sounds good.